I'm Michael Grunwald. I'm a leukemia specialist at the Levine Cancer Institute in Charlotte, North Carolina. I'm speaking about early insights from the REVEAL study, clinical features of polycythemia vera. The REVEAL study is a prospective observational study of patients with polycythemia vera in United States clinical practices. It is a multi-center, non-interventional, non-randomized, prospective observational study. It is looking at an adult population of men and women who have been diagnosed with clinically overt polycythemia vera. Patients are being followed in either community or academic medical centers in the United States and are being observed for 36 months. This is the REVEAL schema. The study set out to enroll 2,000 patients with polycythemia vera. The accrual was later expanded to 2,500 patients. Patients start to be observed upon enrollment and are observed for a period of 3 years, after which they will go off study. The objectives of the REVEAL study are as follows. Primary objectives are to describe the clinical burden of polycythemia vera and to describe healthcare resource utilization associated with the management of PV. Secondary objectives are to characterize the evolution of clinical manifestations of and complications from PV, to describe practice patterns and therapy strategies in patients treated for PV, to describe patterns of sequencing in the introduction of various therapies and how they are related to clinical outcomes, and to assess the impact of polycythemia vera on patient-reported outcomes, including health-related quality of life and work productivity. At the November 2015 data cutoff, 1,687 patients were enrolled from 191 sites. The most common reasons prompting polycythemia vera diagnosis were elevated hemoglobin, positive JAK2 V617F mutational status, and low serum erythropoietin level. 11.4% of patients had a history of thrombotic events at diagnosis. 44.1% of patients had at least one symptom that led to diagnosis. The most common symptoms at diagnosis were fatigue, pruritus, muscle aches and/or bone pain, insomnia, and night sweats. Data regarding patient features at enrollment were also collected. The median age at enrollment was 67 years old. 54% of patients were male. 5.9% of patients reported a family history of PV at the time of enrollment. Patients had blood counts as follows at the time of enrollment. Mean hemoglobin was 14.4. Mean hematocrit was 44.8%. The mean platelet count was 782.8. The mean white blood cell count was 10.6. 19.4% of patients had a history of at least one thrombotic event at the time of enrollment. 11.3% of patients had at least one episode of venous thromboembolism, and 9.2% of patients had at least one episode of arterial thromboembolism. The most common symptoms at the time of enrollment were fatigue, pruritus, headache, insomnia, dizziness, dyspnea, and bone pain. The most common therapies with which patients were treated at the time of enrollment were phlebotomy alone, which accounted for 32.1% of patients, hydroxyurea alone, which accounted for 28.2% of patients, and a combination of phlebotomy and hydroxyurea, which accounted for 24.5% of patients. It is important to note that aspirin was also used in many patients, and that was not considered a therapy in this analysis. To summarize, patients had a high symptom burden at the times of diagnosis and enrollment. Fatigue was the most common symptom reported both at diagnosis and at enrollment. Patients had a high thrombotic event rate at diagnosis that remained high at enrollment. At enrollment, the most common therapies were phlebotomy, hydroxyurea, and the combination of phlebotomy and hydroxyurea. Longitudinal data from REVEAL has the potential to provide a better understanding of the disease continuum, complications, and consequences of PV. Thank you very much for your attention.